In essence, the diagnosis of hair loss in women is usually a clinical diagnosis. You can make it with visual inspection of the scalp. You don't need to do any biopsies or investigations, and the simplest way to do it is to examine the scalp from above and look for widening of the central part. And we've developed a clinical grading scale that defines what's normal and what is abnormal. And what we know is that as women age, their hair gets thinner. So there's no 80-year-old woman on this planet who's got hair like an 18-year-old. As you get older, your hair grows thin. And when that thinning becomes noticeable, or if that thinning has occurred prematurely, so not at a rate far in advance of what you'd expect for your age, then it becomes a clinical concern and people attend physicians to be seen. And what we've developed is a clinical grading scale that allows physicians in their rooms to help with the diagnosis of female pattern hair loss and also grade the severity. And you can use that clinical grading scale to monitor their response through treatment. And the other thing that we can do with the clinical grading scale is we can show to people what they would expect when they embark upon treatment. So you can say, well, we would expect at the end of 6 months that you would achieve this much regrowth, maybe at 12 months you might achieve that, and we can tell them what's realistic and what's unrealistic in terms of expectations they can have from medical therapy. And at the end of the day, our patients need to make a value decision in terms of, if I embark upon this course of treatment, if I have so many visits to the doctor and I start these treatments, what am I likely to expect? And then they can actually make a decision whether what they can achieve is actually worth that time and expense and that effort to undergo that process. So the way in which we use the hair loss severity scale is that we part the hair in the middle and we examine from above. And the stage 1 is what we would consider normal, and you've got a very tight, fine part line, and there's good density of hair on either side of the part line. And we know it's normal because we went into schools and we examined children between the ages of 5 and 9, too young to develop any hair loss, and we know that pretty much everybody starts with that amount of hair density. So that's the baseline. Stage 2 is when you're first starting to see widening of the central part, and you can see a little bit of extra skin in the middle of the part line, but the hair density either side of the part line is still quite good. Stage 3, you're starting to get diffuse thinning at the edges of the part line, so the part line is further widened, and stage 4 is when you start to get a visible bald spot right in the anterior part of the hairline, and stage 5 is more severe hair loss. And this hair loss severity scale has largely replaced the Ludwig grading scale, because the Ludwig grading scale, which was a 3-point scale, didn't really reflect what it was that we were seeing in the clinic, and it didn't really define the subtleties of hair loss, and it wasn't really useful for diagnosis or for monitoring of treatment. When women come in with hair loss, they either present with increased hair shedding, so in other words there's more hair coming out in the brush or comb, or they present with a diffuse reduction in hair volume, so the part's widening and they're basically, there's bald skin visible on their scalp. Now, if they come with hair shedding, the hair shedding is often one of the things that distresses them more. So you would imagine that it's the baldness that they would be worried about, but for some women it's the hair shedding that's a great concern, and for some women of course it's both. Now, one of the problems we have is that most women don't know what's a normal amount of hair to shed. So if you look up the internet, it says you should shed 100 hairs a day, but what does that actually look like? And we developed a scale that we validated with 6 stages, and again we did a comparison with schoolgirls to try and define what was normal. So what amount of shedding could a woman normally expect to see before they've got any androgenic alopecia. We also compared it to women with hair loss. And so each one of the bundles represents a certain quantity of hair, and that's listed on the side. And the way in which we use it is we show the women a photograph of this on an A4 size, and we ask them to point to the photograph that best represents how much hair they would lose on an average day if they bundled it all together. Now, because women don't wash their hair every day and you shed a little bit more on a wash day, we also ask them how much would you shed on a wash day, how much would you shed on a non-wash day, and we record the frequency of their washing. And that is also a very useful monitor that you can do every visit. It only takes a few seconds. It's a useful guide as to what's happening with their hair shedding. And we know now with some of the newer treatments that you can reduce the hair shedding, and that's meaningful to the patients, and you can document that in a really simple bedside quiz that only takes you a few minutes, unlike some of the complicated brushing techniques that people used to do and hair pull tests to monitor the amount of hair shedding. This is a really simple and easy test to use, and patients can score accurately the amount of hair shedding. Certainly the women patients can. I think the men would look at it with a bit of confusion, but the women know how much hair they shed each day, and it's very reliable, and it's also very reliable from appointment to appointment in terms of scoring changes in hair shedding in response to treatment. So one of the biggest problems that doctors face in terms of treating women with hair loss is monitoring their efficacy, because patients don't necessarily have a reliable memory of what their hair loss was like at baseline. And so if you're taking serial photographs, you often find women who have done very well with the treatment, but who feel that their hair is getting worse. And when you show them the photographs, that straightens out. Now, not everybody is able to take serial photographs of good enough quality to use for monitoring. And so if you're not using the photographs, using this scale is a really useful way in the clinic to monitor what they were like at baseline, how they're responding to treatment, and give you a little bit more objective evidence as to how they're going with the treatment and whether you need to adjust the dose up or down based on response.